Ovulation irregularities, structural problems, low sperm count, and underlying medical problems. In this video today, we are going to talk about the most common reasons for you not getting pregnant. If you have tried to get pregnant, but things have not really worked out very well, there could be a problem, there could be an issue which needs to be addressed. Gerard Massa, the health educator, is the name of the channel. I welcome you to our channel. If it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day about fertility, about reproductive health. So, what are the most common reasons for not getting pregnant? Without further ado, we shall go to our first reason why you are not getting pregnant. Number 1. Ovulation irregularities. If you have issues with your ovulation, by the word ovulation, I mean the release of a mature egg that's supposed to be fertilized on the 14th day to become an embryo. So if a woman has issues with her eggs, if a woman has issues releasing her eggs, then there's going to be difficulties getting pregnant. Mu video yaffe ne ya leero tuli kwogerako biki ebiviirako okubanga omukyala agezaako okufuna olubuto naye n'abanga tasobodde kubanga afuna mangu olubuto. Tugambye nti reason esooka kyekyo kye tuyita ovulation irregularities. Omukyala waba alina obuzibu n'amagi ge era aba agenda kufuna obuzibu mu kufuna olubuto. We are proceeding with our topic for today, and we have said that ovulation irregularities is the first reason why you could be trying to get pregnant, but things are not working out well. You could be having ovulation irregularities. By ovulation irregularities, I also mean you could be having difficulties, or you could be having what we call hormonal imbalances. When we talk about hormonal imbalances, the hormones we are talking about here are mainly two. The first hormone is known as the follicle stimulating hormone, and by follicle we mean the eggs. So that hormone which makes your eggs to grow, if it is being released in insufficient quantities, then there are high chances that you could actually end up with what we call ovulation irregularities. Thus, you may actually have difficulties getting pregnant. Failure to get pregnant, reason number 2. Structural problems. Structural abnormalities or structural problems specifically means that when you take a closer look at your womb, your uterus, ideally it's supposed to be having a well-defined endometrial stripe, or the inside of your womb should be clean. The walls of your womb, which we call the myometria, they should be healthy. There should be no masses or fibroids or swellings. If your womb or if your uterus is full of issues, if it is having large swellings, we call them myomas. Some doctors call them leiomyomas. If your womb has those swellings, or if your uterus has lots of cysts, or inside your womb, if there's free fluid which is collecting there, we call it endometritis. If you have such complications, then there could be a chance that you could have difficulties getting pregnant. Remember, you can easily get pregnant, but the main goal of this channel is to create awareness. These videos are for education and information purposes, so that you may know what could have been preventing you from getting pregnant. So, reason number 2 for failure to get pregnant is structural problems. And remember, our first reason was ovulation irregularities. So we shall go to our next reason, and this is what we call low sperm count. If you are trying to get pregnant, you are a couple, you've been together for some time, and you've tried to get pregnant, but things are not working out very well as expected, there could be a reason. There could be something to do with the sperm count of your husband. Your husband may be releasing sperms which are of poor quality and poor quantity. So if at all a man has conditions, for example, zoospermia, whereby the amount of sperms being produced are very, very low. Then there's going to be difficulties making a woman pregnant. Remember, a sperm has different parts. There's that part which is known as the head of the sperm, there's the neck, and then there's the tail, which does the swimming so that the sperm moves along the whole distance of the womb plus the whole length of your fallopian tubes. So if at all your sperms have poor shape, if they are of poor quality, they may not move through the whole length of the tube or the whole length of the fallopian tube or the womb to reach the egg. And remember, fertilization happens in a part known as the ampulla or that junction of your fallopian tube. So the sperm has to be healthy so that it can swim the whole length through the fallopian tube up to that junction where fertilization will take place. And remember, we've talked about fertilization on our channel in our previous videos. If you missed our previous videos, kindly after watching this one, you can easily go back to our library, our playlist on this channel, Gerard Master, the health educator, so that you go through our videos and you will be able to learn more about ovulation, about fertilization. But as a recap, you realize that when an egg has been released, when a male sperm is released, it contains 23 chromosomes, and the female egg also contains 23 chromosomes. So the two fuse, or they join together, or they meet, and then fertilization takes place. We end up with an embryo which is having a total of 46 chromosomes. And remember, we've also said that if that fusion or the joining of the male and the female egg takes place, but the chromosomes do not total up to 46, or they are more than 46, then we end up with what we call chromosomal abnormalities, or we end up with congenital defects or congenital abnormalities in the final child that will be formed. So we are proceeding with our main reasons, or the most common reasons why you are not getting pregnant. The most common reasons for not getting pregnant. We've talked about ovulation irregularities. We've talked about structural problems. We've talked about low sperm count. And now we are going to talk about the underlying medical problems. If you are a couple and you have tried to get pregnant, but things are not working out well, there could be underlying medical problems. By the term underlying medical problems, we mean you could be having some issues. For example, if your eggs have what we call polycystic ovarian syndrome, a condition or a hormonal problem whereby a woman releases lots of testosterone. Testosterone is a male hormone. So if a woman releases too much of this hormone, then there's going to be issues with her ovaries, and she may actually end up having difficulties getting pregnant. And remember, we've talked about polycystic ovarian syndrome on this channel. You can always go back and look at our playlists. There's lots of information about polycystic ovarian syndrome. And remember, you can easily get pregnant even if you have this condition. You actually have to see your doctor who will do the whole assessment. On this channel, we do create awareness about fertility and reproductive health. Gerard Master, the health educator, is the name of the channel. Era mu video yaffe ne yaleero tubadde tuli kugamba nti ebiviirako omukyala okubanga afuna obuzibu mu kufuna olubuto kiyinza okubanga nambemu alina kye tuyita ovulation irregularities. Amagige gayinza okubanga tegakola bulungi, ayinza okubanga alinamu obuzibu okubanga amagige gavaayo ne gasisinkana amazzi g'omusajja, oba ayinza okubanga alina obuzibu nti amagige manafu nnyo. Ne tugamba nti ayinza okubanga alina ekirala kye tuyita structural problems, oba nabanaye ng'ejjuddemu bizimba, ng'oba alina amazzi amakyafu mu nabanaye n'olaba nti nakyo kimulemesa okufuna olubuto. And then we also said low sperm count. Omusajja ayinza okubanga alina enkwaso naye ng'ate enkwasi zo nnafu nnyo. enkwaso ze nga nnafu nnyo tezisobola kuwakisa eggi ery'omukyala kye tuyita low sperm count. And then n'ekirala nga low sperm count basically kitegeeza enkwaso nga nnafu ate nga ntini. Ebyo byonna byonna tuba tusobola okubijjanjaba kasita tujoininga ku WhatsApp. And then tugambe nti wayinza okuba nga waliwo underlying medical problems. So wayinza okuba nga waliwo ebirwadde ebirala ebigezaako okuba nga bimulembesa okuba nga afuna olubuto era aba alina okulaba omusawo n'amujjanjaba. On this channel we do create awareness about fertility. Remember, you can schedule your appointment so that you can book and consult me. If you would like to talk with me in privacy, you can actually join me on my WhatsApp and then we shall be able to talk. The link is in the description below this video. You can easily go there, join me, and then we shall actually have more talk about fertility, about how you can get pregnant. So if you have been trying to get pregnant and you really are not getting pregnant and you'd like to have a one-on-one consultation with me, you can just go below this video in the description and in the comment section. That first comment, you'll be able to consult me. Have yourself a fantastic and healthy day and see you in my next video tomorrow. May God bless and protect us all. And I'm known as Gerard Massa, the health educator. Bye-bye and see you tomorrow. Bye-bye. What is the most common reason for not getting pregnant? What is the most common reason for not getting pregnant? In this video today, we are going to discuss the most common reasons for not getting pregnant. Gerard Massa, the health educator, is the name of the channel, and on this channel we do create awareness about fertility and reproductive health. Mu video yaffe ya leero tugenda kwogera ku nsonga ki ezisobola okubanga zikuviirako okubanga tofuna lubuto. Nsonga ki ezikuviirako okubanga ogezaako okufuna olubuto naye nga toli kubanga olufuna. We are talking about the most common reason for failing to get pregnant. So we are discussing all this, and our first reason is this: failure to ovulate. When you are trying to get pregnant and things have been difficult, you have done everything but you are not getting pregnant, the issue could be with your ovaries. If you are not ovulating, remember we've said that ovulation is the release of a mature egg. That actually happens on the 14th day of your menstrual cycle. From the first day you've seen your menses, you count 14 days. That 14th day is what we call the ovulation day. So if you are not ovulating, in other words, if you are not releasing a mature egg, also known as a Graafian follicle, on the 14th day, then getting pregnant is going to be very difficult. So if you are a woman out there and you have tried to get pregnant and things are not working out, the issue could be that you may not be ovulating. So reason number 1, failure to ovulate. Tugambye nti omukyala yenna agezezaako okufuna olubuto naye n'abanga tasobodde kufuna lubuto, kyandibanga alina obuzibu ne kye bayita ovulation, kyandibanga alina obuzibu amagi ge nga gabadde tegakola bulungi, nga ta ovulating, nga amagi tegavaayo kusisinkana nkwaso z'omusajja. We are talking about the most common reasons for not getting pregnant, and we have finished our first reason, and this is failure to ovulate. We are moving to our next reason, next common reason for you not getting pregnant. Reason number 2, problems in the menstrual cycle. If you have your menstrual cycle having actually issues, it's irregular, your menstrual cycle is irregular, you have issues with your menstrual cycle that you expect to see it today, but you do not see your menstrual cycle. You actually expect to have a normal flow, but you get heavy flow. Then, or if you expect just something like the normal, your menstrual cycle being normal, but it actually all of a sudden becomes abnormal, then this could indicate that there's a problem still, which it could actually be making it difficult for you getting pregnant. And normally changes in the menstrual cycle could be brought about by hormones. So if you have problems in the menstrual cycle, you are trying to get pregnant but things are not working out, the issue could be with the menstrual cycle. So reason number 2 for you not getting pregnant, problems in the menstrual cycle. Remember, the first reason was failure to ovulate. The next one is problems in the menstrual cycle. Reason number 3, structural problems of the reproductive system. If you have a normal reproductive system and you have tried to get pregnant and the pregnancy has not yet happened, I would suggest you have to be patient for at least 6 months or even 12 years, depending on your age. If you are a woman and you are 35 years and above, you are above 35 years, then we always recommend that you be with your partner for at least 6 months. If you are below 35 years, you are with your partner but you are not getting pregnant, then we recommend that you actually need to be assessed by your doctor, your fertility doctor. Remember, on this channel we do create awareness. Our videos are for information and education purposes only. So if you are having difficulties getting pregnant, there could be structural problems of the reproductive system. By structural problems of the reproductive system, we talk about a reproductive system which is actually not normal. If you have masses or swellings in your reproductive system or on your reproductive system, these masses could include swellings, for example, cysts. And remember, we've said that cysts are fluid-filled swellings. You have a swelling, but it is filled with fluid. We call this a cyst. Now, these cysts may come as a result of repeated urine tract infections. They may come as a result of hormonal changes. So you need to have yourself get checked by your doctor why you are not getting pregnant. You could be having structural problems of the reproductive system. And how do you confirm this? You do what we call a pelvic ultrasound scan. Gerard Massa, the health educator, is the name of the channel. I welcome you, my friend. If it's your first time on our channel, we do talk about fertility on this channel. Why are you not getting pregnant? On this channel, you find solutions as to why you are not getting pregnant. So tugambye nti ekyokubanga ogezaako okufuna olubuto naye ne bibanga bikutawanyiza, wandibanga olina obuzibu n'abaana ng'eriko obuzibu, oba n'ekirala oyinza wandibanga olina obuzibu ne menstrual cycle yo oba periods zo ziyinza okubanga zafuna obuzibu ng'olina hormonal imbalance mu periods, ne hormonal imbalance nereeta periods obutatereera. N'ekirala oyinza okubanga olina obuzibu n'abaana kye tuyita structural problems of the reproductive system. N'abaana eyinza okubanga ndwadde ng'erimu ebizimba oba ng'erimu enkovu ezivudde ku repeated urine tract infections or repeated UTIs. So the most common reasons for you not getting pregnant is our topic for today. And reason number 4, infections. When we talk about infections, Infections is a big term, but in this particular video, we are going to talk about why you may not be getting pregnant. Infections could be the most biggest reasons why you are not getting pregnant. Presence of free fluid in a particular part of your reproductive system known as the pouch of Douglas could indicate that you have a PID. A PID is what we call a pelvic inflammatory disease. Now, if at all you are a woman and you are having a PID, your doctor has told you that you have a PID after doing a pelvic ultrasound scan. This means that you have presence of free fluid, which may actually ascend upwards. It may go upwards up to the inside of your womb or your uterus, bringing about a condition known as endometritis. It can actually also go to your tubes, and it may cause what we call hydrosalpingitis, free fluid in the salpinx or in your fallopian tubes. Now, when your tubes are filled up with fluid, when you have fluid or dirty fluid in your womb as a result of repeated infections, then at the same time you are trying to get pregnant, this can actually make everything difficult. The main reason is that the fertilized egg is supposed to move through the fallopian tube up to your womb, where it will attach or it will implant, and then it will grow into a baby. If the fallopian tubes are blocked with free fluid, where is the fertilized egg going to pass? If the fallopian tubes are blocked with tissue or adhesions, where is the fertilized egg going to pass? At most, the fertilized egg might actually remain in your fallopian tubes, ending up or bringing about what we call an ectopic pregnancy, baby in the fallopian tubes. So we are talking about what is the most common reason for you not getting pregnant. Gerard Massa, the health educator, is the name of the channel, and I welcome you on our channel. On this channel, we do create awareness about fertility and reproductive health. And in today's video, we are talking about the most common reason for you not getting pregnant. We've talked about reason number 1, which is failure to ovulate. I believe you have a pen and you are noting this down. The first reason is failure to ovulate. Reason number 2, problems in the menstrual cycle. Reason number 3, structural problems of the reproductive system. And reason number 4, infections. And we've said that specifically infections like PIDs or pelvic inflammatory disease make your chances of getting pregnant actually very low. I'm not saying that you will not get pregnant if you have a PID. You will get pregnant, but the chances of the pregnancy ending into a miscarriage are very high. For example, women who have untreated chlamydia infections or untreated syphilis, they have a high chance or a high risk of ending up with a miscarriage in their pregnancy, which is not good news. So the main reason for this channel is to create awareness, to actually bring about prevention, not to wait for you to have the miscarriage and then say, oh, I wish I got checked out. So if you are planning on getting pregnant, or if you are pregnant, please kindly have yourself get checked by your health worker. Your health worker will request for some tests. These include the pelvic ultrasound scan, urine analysis test, rapid plasma reagent, also known as the RPR test for syphilis, and then also if there's a good lab in your area, then you could actually, your doctor could also do what we call a urine culture and sensitivity, where all organisms will be sensitized and cultured, and of course they will be cultured and sensitized, and the drugs to which they are sensitive to, any organisms or bacteria that has been identified, will be actually treated appropriately. So we are talking about the most common reason for you not getting pregnant. We are moving on, and if you've stayed with me for this while, I'm really so happy, and please kindly stay on. We are proceeding with our video lesson for today, and I will be very happy when you actually attend the lesson up to the last reason why you could not be getting pregnant. We are moving to our next reason for you not getting pregnant. What is the most common reason for not getting pregnant? And this is what we call implantation failure. implantation failure. Now, if a woman is planning on getting pregnant, she gets pregnant, actually you be with your partner, you have sexual intercourse, you actually, fertilization takes place, the egg comes through your fallopian tubes. The egg travels through your fallopian tubes up to the side or the lining of your womb, also known as the endometrium. This fertilized egg is supposed to attach itself onto the wall of your womb. Now, if the fertilized egg comes up to the wall of your womb, it has traveled the long distance through the fallopian tubes, and now it is in the womb. It is looking for a place to attach. But remember, we've talked about infections being among the leading causes of miscarriages. If the wall of your womb, if the inside of your womb was affected with free fluid, if the wall of your womb was affected by free fluid, or if you had infections, repeated infections, you have chlamydia, you have trichomonas, you have what? You have endometritis, infection inside your womb, then the fertilized egg will not implant onto your endometrium. In simple terms, the fertilized egg will not implant into a womb that is affected by disease. So, if you are a woman and you are trying to get pregnant, every pregnancy you get ends up into a miscarriage. There could be an issue with the inside of your womb. It could actually be the main reason why you are having what we call implantation failure, and in a nutshell, implantation failure could be the reason or among the most common reasons why you are not getting pregnant. So, if you are trying to get pregnant and every pregnancy you're getting does not work out, have yourself checked out. You could be having an incompetent cervix. You could be having a chronic PID infection. You could be having an endometritis infection. You could also be having disease of the fallopian tubes. Remember, if you would like to schedule your consultation with me, you want to find out why you are not getting pregnant, you can actually go right away in the comment section and ask your questions. I will be able to answer your questions. And also, the way to book is also down in the description. You can always book to have a private consultation with me. We are moving on with our reasons for you not getting pregnant. And the next reason is you could be having endometriosis. Remember, we've said that endometritis is infection of the inside of your womb. Infection or inflammation of the inside of your womb is what we call endometritis. Endometriosis is the presence of uterine tissue, the inside of your uterus, that tissue which makes your uterus. If those cells that make your womb, or if those cells that make up your uterus begin growing outside your uterus, we call this endometriosis. According to research, it's among the most common reasons why you may try to get pregnant, but the pregnancy does not happen. So, if you have been trying to get pregnant and things are not working out, you could be having endometriosis. And we've said that this is presence or growth of uterine cells, or the cells that make up your uterus, outside your uterus. The cells that make up your womb growing elsewhere, maybe they grow in your bowel, in your intestines, or they grow in the abdominal cavity instead of them growing or bringing up the growth of your womb. Then we call this endometriosis. It could be among the reasons why you may not be getting pregnant. Next reason for you not getting pregnant is polycystic ovarian syndrome. We've talked about polycystic ovarian syndrome in many videos on this channel. Remember, if you would like to know more about polycystic ovarian syndrome after this video, kindly go to my video library and then you will be able to know more about polycystic ovarian syndrome. But in a nutshell, polycystic ovarian syndrome has 4 letters. It has four words. So it has P, and then it has C, and then it has O, and then it has S. So P stands for poly, which means many. C stands for cystic, which means a swelling which is filled with fluid. And then ovarian, of course, comes from your ovary. And then syndrome is a collection of all these symptoms, or a collection of all these we've talked about. So if you have tried to get pregnant and things are not working out, the issue could be that you could actually be having polycystic ovarian syndrome. If you have tried to get pregnant and things are not working out, there could be a hormonal issue. Remember, polycystic ovarian syndrome is a hormonal condition. It's a condition whereby a woman releases high levels of the male hormone known as testosterone. If a woman has high levels of testosterone, there are high chances that she will actually not be able to get pregnant very easily. So she can get pregnant, but women with polycystic ovarian syndrome have high levels of the luteinizing hormone. Now, luteinizing hormone is supposed to bring about ovulation, and it's supposed to be released on the 13th or the 14th day. But if at all it is released throughout your menstrual cycle, then pregnancy may be difficult. But remember, when you see your doctor and all assessments are done, there are high chances that you can get pregnant. Next reason for you failing to get pregnant is primary ovarian insufficiency, also known as primary ovarian failure. If a woman has primary ovarian failure, if a woman has ovaries that are not functioning very well, there are high chances that she may actually have issues getting pregnant. And lastly, if a woman has fibroids, if you have uterine fibroids, you've tried to get pregnant but pregnancy is not happening, it could also be due to the fact that you could be having fibroids. So remember to get yourself checked out. You could actually be having either one or two of these, and the good news is that if it's identified early, then treatment can be given, apart from the primary ovarian insufficiency, which is very, very difficult to treat, but the rest are actually treatable. So I thank you, my friend, for staying with me for today's video lesson. We talked about what is the most common reason for not getting pregnant, and in summary, we said that the first common reason why you may not be getting pregnant is failure to ovulate. Next, problems in the menstrual cycle. Next, structural problems of the reproductive system. Infections, failure of an egg to mature properly, implantation failure, and then we also talked about endometriosis. We talked about polycystic ovarian syndrome being among the common reasons. Primary ovarian insufficiency, not so common, but it could also be preventing you from getting pregnant. And lastly, we said uterine fibroids. And remember, there's a point we didn't expound more. This point of failure of an egg to mature properly. Now, when a woman is ovulating, she's supposed to be actually going through the two phases. The first 2 weeks of your menstrual cycle are what we call the follicular phase. The next 2 weeks are what we call the luteal phase. Follicular phase comes from follicles. Your eggs will just be growing. They will go through the primordial stage, then they will go through the secondary stage, and then lastly in the tertiary stage. Now, if the eggs start to grow, but due to some issues, due to low levels of hormonal follicle stimulating hormone, or due to low levels of FSH, they fail to mature properly, then pregnancy may be difficult. So you not getting pregnant, it could be that your eggs are not maturing very well. So you need to get yourself checked. You could actually be having this. It's treatable and you can get pregnant. You can have that child you've been praying for, that happiness you've been praying for. You actually have to get all these facts in order. And also, without forgetting, the biggest point you need to take home is that we can tell you what we were told in school, but you need to go down on your knees and pray to God for everything. And I believe in God. I believe God can provide whatever. God can answer all your prayers. Tubadde tukogera ku biki ebisobola okubanga bikuviiramu obikuviirako okubanga tofuna lubuto. Ne tugamba nti ensonga esooka oyinza okubanga olina kye tuyita failure to ovulate. Oyinza okubanga to ovulatinga amagiko nga galina obuzibu. Ne tugamba nti ekirala oyinza okubanga olina problems in the menstrual cycle. Menstrual cycle oba cycle yo eyinza okuba nga tetambula bulungi, nga maybe olina obuzibu mu hormones oba periods zo nga teziteredde bulungi nga weetaaga okwekebejja. Ne tugamba nti oyinza okuba nga olina kye tuyita structural problems of the reproductive system, and then lastly ne tugamba nti oyinza okuba nga ne tugamba nti oyinza okuba nga olina infections, nga olina infections ezikutawaanya obutafuna lubuto. Oyinza okuba nga olina kye tuyita failure of an egg to mature properly, oba amajigo gayinza okuba nga gaakona nga tegakula bulungi nga weetaaga treatment. N'ekirala oyinza okuba nga olina kye tuyita implantation failure, and then of course amajigo nga gajja egirijja naye terisobola kuba nga yekwata ku kisenge ky'abaana okukula. Ne tugamba nti oyinza okuba nga olina kye tuyita endometriosis. Endometriosis kiba kitegeeza obusirikale obukola nabaana oba nabaana ennyama ekola nabaana okubanga ate mu kifo ky'okubanga eri ku nabaana ate nekulira mu byendabyo, ekyo nakyo kisobola okuviirako obutafuna lubuto. Ne tugamba nti oyinza okuba nga olina kye tuyita polycystic ovarian syndrome. Polycystic ovarian syndrome kiba kitegeeza nti amajigo galiko obuzimba bungi nnyo, nakyo kisobola okuviirako obutafuna lubuto. And then ne tugamba nti oyinza okuba nga olina primary ovarian insufficiency, oba amajigo ng'era gaakonera ddala nga tegasobola kuba nga gakula. And then ne tugamba nti wandibanga olina n'ebizimba, so oba ogezaako okufuna olubuto nga bikyagaanye, ebimu ku zino ensonga zetwogeddeko ziyinza okuba nga zeezo zennyini ezikuviiriddeko obutafuna lubuto. Osobola okubukinga n'oyogera nange. Booking ya siringi 15 zokka ezaffe wano ez'e Uganda. Ogenda mu description link mweri noba nga okola payments, and then from there ne tuba nga twogera ebisingako ku butya bw'osobola okufuna olubuto amangu. Remember, if you would like to consult me, you would like us to discuss why you could not be getting pregnant, you've done everything, you can actually go to the description of this video, and then you will be able to actually book to consult me, and then we shall discuss why you may not be getting pregnant. Thank you and have yourself a fantastic and healthy day. Bye-bye.